you go to the website of most hospitals, you look under Human Resources, you will see a link that says volunteer. So you click on that, and it will tell you at that hospital or at that clinic what it will take to sign up as a volunteer. Okay? Now, you will also, most of them, I've seen there's a TEAS test that you have to take. And we don't offer that test. The nursing departments will tell you where you can take that test. What you want to know is how often you can take that test. Because what you don't want to do is at the end, when you're kind of, sort of stressing about applying and getting all your courses and taking your classes, you don't want to wait to take this too long, but on the other hand, you don't want to take it too early. And if you can take it more than once and it's not going to be averaged, then maybe take it to practice so that you know what to expect. So, and that's a question you can ask during those advising sessions. So, like I said, it's kind of strategic. Okay, so if you scroll down, so they're telling you point systems, how many points you get. When it's lottery, a lot of times it's just purely lottery. So in other words, sometimes it gets kind of complicated or complex, where sometimes students with certain GPAs are put in one lottery pool, and other students with different GPAs are put in another lottery pool. That way it's not really the 4.0 everybody. So a lot of times they'll do that. So you can ask that question, how do you conduct your lottery? And so that'll kind of give you an idea. That way, people who are closer to the 3.0 get a chance, as well as the people who have a 4.0. So there are different ways to do that. So let me move on with some more strategies. Any questions so far, though?
So say if you have like 3.5 or something, but you're doing the volunteer work, and I know the club also probably looks good. Can you be equivalent to somebody who just has a 4.0, or is that all they're looking at?
No, they look at it all. Yeah, they look at it all because, there are some people who are not as strong academically but would make terrific nurses. And you've probably met people like that. They just have a really good rapport with people. And so you want to give those people a chance, and I think they try to give those people a chance.
Another question, if you do end up getting your associate's degree, I've heard of ways if you get that, then you can actually work through at night to do bachelor's. Is that, okay, I didn't know if you go through how that works.
You can get, and sometimes what students will do is they'll get an associate's degree and they want to work for a while, and then maybe the bachelor's degree is in the future. So you can do that, and a lot of times the bachelor's program will let you take exams to test out of the lower nursing courses. And so they'll do that. So for an example, if you look at UCLA, they're one of the few UCs that have a nursing program, but they're for people who have an associate's degree already in nursing, who now want a bachelor's degree. So you will see those kind of programs.
So it's on a separate program, you don't have to go full-fledged all the way.
Yeah, so you'll see, and you'll see it sometimes titled like an advanced degree, or sometimes they call it a bridge program. So you'll see it like that. So some of the 4 years you'll see where you can only, like UCLA's program, you can only enter it. So none of you could enter the program. You have to have your associates in nursing first. It's an RN.
Should I apply for volunteer before apply to the CMU, or after getting the CMU?
Before. Before, because it's going to be a selection process. So how they decide who gets in will be partly based on your volunteer experience as well as your classes. Okay, I'll take one more question and I'll move on. Did you have a question? Okay. So attend those pre-nursing meetings, because those are really important. Now you need to make sure that you, again, keep tabs on the nursing department websites, because, for example, Cal State East Bay made a major change last year. So the fact that you have to do all your prerequisites this semester is the first time that's been in effect. Prior to that, you could have, I think, 2 in progress. Well, they made that change like late last year, and we all complained and said, you can't do that to students. You can't just make a policy change and not give folks enough time to finish up. So they delayed it a year, but they actually had wanted to implement it last year. So you want to make sure that you check regularly, because the departments forget that there's a World Wide Web out there and that there are people trying to get in. You know, a lot of times they forget that it's not just the students on their campus wanting to get into the program, there are other students too. Let's see, we talked about volunteer experience. Oh, apply to more than one program. Okay, now sometimes students will ask me, should I transfer and then apply to nursing? That limits your choices. So let me tell you priority, because a lot of people don't understand this. For universities, first priority to be admitted to the university goes to transfer students across the board, UC and CSU. So you guys get all of the spots first. Then freshmen at a high school, second priority. Third priority, inter-system transfers. So if you transfer, say, to San Francisco State, and you didn't get into the nursing program, and you want to apply, you can only then apply to San Francisco State's nursing program. You won't be able to apply to any other nursing program because your status is not a transfer student anymore. You are a university student. So you're like third. So if you are going to apply to multiple programs, so going back to that, if you only have 25 spots, do you think they're going to get to the third level of choice? No. So from our level, you apply to more than one program. And then, so the wider net you cast, the more likely you are to be able to get into a program. There are no guarantees, but that doesn't mean that you can't try. My student Stephanie used to be the president of this club. On her first shot, she got into San Francisco State. No one was more shocked than she was, but she was a great student. She didn't have a 4.0. She had a very strong GPA. But she worked her way up from being an attendee of this club to being the secretary to being the president of this club. She did volunteer work. She was active because what do you think nurses have to do? So if you think about the profession, nurses have to be proactive. If you sort of sit back and expect people to give you information, it's not what they want to see in a nurse, because you have to make some critical decisions. So you want to reach out, you want to get information, you want to share information. I talked about pooling your resources. You should meet regularly with us in counseling. So a lot of times, like for example, this has nothing to do with nursing, but Cal State East Bay made a huge change to their business major, but it's nowhere on their website, it's nowhere on the SIS, it's nowhere anywhere, but we know about it. So they try to, talk to us, keep us informed.
One of my students that was interested in San Francisco State told me that they were really looking for multicultural experience too. So he had me stress that. He did get in, and he had a fantastic grade point average too. But that's another thing that's going to matter.
And that's a really good point, because if you think about our population, especially in California, if you're working with people from other cultures, it's important to be culturally sensitive. And so having that experience is really important. Okay, so let's see. So these are some websites. So one of the best websites is the Board of Nursing for California. If you're thinking about going out of state, I don't know if any of you are thinking about going out of state, but if you are, you'd want to look at their Board of Nursing. Somebody actually asked me about University of Nevada, Reno. So, okay, so the thing is with them, because it's another state, again, you want to contact their nursing department. If you cannot travel to Reno, then ask if you can have a telephone appointment or if they have online advising. So you can do that too. The other side of it is you want to know that when you come back to California, how difficult it will be to practice. So that's, a question. A lot of times folks will leave California and then they have a hard time getting back into the profession that they want. So you want to make sure that there isn't any differences there. If you're interested in some nursing scholarships, and these are on the handout that I gave you, so you don't have to write it down. And the Discover Nursing website is a really good website. Now, some questions that you want to ask the nursing departments so that you get a really clear idea of what it's going to take to get in. You want to find out, for example, do you have 2 applications? For the CSUs, it's pretty clear. It's usually 2. But if you're thinking about private schools, they have a different process, because private schools